Hey guys, what's going on? Tony Maritato here. Welcome to the Total Knee Replacement Support Group. This is a Facebook Live. I actually recorded an entire video, like 7-8 minutes of all the content I'm gonna cover here. But you know what? It's on my other camera in the office. So I promised a video today. I wanna share that video today. If you guys are jumping on live, just post a hi, post a comment. So the question came up in the group. What do we do? What is scar tissue mobilization? What do we do to improve scar tissue healing? Let's start with just the basics. Now, I'm by no means a wound specialist. We have Heather in the group. We have other clinicians that are in the group who deal with wounds day to day. They are like, they know it all. What's up, Debbie? But I'm going to give you what I can. I'm going to give you my limited experience, my limited information. Hey, Jamie, and you can take it for what it's worth. So our understanding and the way we learn kind of tissue healing, you know, scar tissue kind of has a negative connotation. We think of scar tissue as being a bad thing. We think of scar tissue as restricting motion. It's basically evil when it comes to total knee replacements in our minds. But the reality is, without scar tissue, we would never function. We couldn't heal. The incision would never close. Scar tissue is vitally important. And while yes, there is some truth to the idea of scar tissue adhesions limiting restriction, I would say by far the threat of scar tissue limiting your mobility, unless you were literally casted in a single position, flexed or extended, and had zero opportunity to move the knee within a day, within a week, within a month, you really don't have to worry too much about the scar tissue. Scar tissue is an incredible material. Our body needs it, our body uses it. Don't hate it, appreciate it, and learn to work with it. And so basically what I'm gonna do, I'm gonna set up the camera so that you guys can see. I did a little artwork here on my knee. This is a marker drawing. Hopefully you guys can still hear me okay. And basically what happens during the total knee replacement procedure. Now, every surgeon's gonna be different. What's up, Vincent? Every surgeon's gonna be different approaches, different everything, I get it. But generally speaking, there's gonna be a superficial incision through the skin. That's gonna be the vertical incision that we see after the knee replacement. Once they make that incision, they pull the skin apart, your patella, your kneecap is sitting right in the middle of the knee. This is my kneecap right here. The surgeon typically then makes a secondary incision inside the joint to open up the joint. The kneecap is shifted over to the side. There are some amazing videos on YouTube. If you've never seen the procedure and you're not super squeamish, go look at what they did. I think you will have a whole new appreciation. That's right, don't hate it, appreciate it. You'll have a whole new appreciation for why you're so sore, why you're so stiff, why things are so hard once you see what actually happened to the knee. And then maybe you'll cut yourself a little bit of slack and say, you know what? I'm doing amazing for what they did to my knee. Okay, enough preaching. Let's go back to it. So you've got that external superficial incision. That's the one we see. That's one everybody's obsessed about. But a lot of patients will come in complaining of pain on the inside of the knee joint. Quite often it's that internal incision that you just don't see or know about. So let's talk about the superficial one for this. Basically what happens is whether you have staples, internal stitches, glue, you know, whatever device or mechanism they use to seal it back up. Once there's no more seepage, once there's no more bleeding or leaking or anything like that, you can really start to move the skin. And typically what I ask my patients to do is obviously wash your hands, keep it clean, but don't use lotion. I know they recommend vitamin E and different things, but for this part, no lotions, no cream. You don't want to slide over the skin. You want your fingers to actually stick to the skin. And a lot of times what I'll do is I'll say, use your non-surgical side as a control. Feel the way your skin moves. You know, I'm 44. Some of you are older, some of you are younger. You're gonna have more movement through the skin. Some people will have less. But the idea is your tissue is layered on top of each other. Imagine I took 3 pieces of paper and I stacked them on each other, if I move the top piece of paper, it would slide relative to the second piece of paper, but probably not move the third piece of paper. So when people are saying, and I don't want to discredit anybody, but when people are telling you we're breaking adhesions and we're moving stuff deep in there, we're really not. You know, the reality is it's almost a frictionless environment between the skin and the tissue below. The best we can do is move the layer of skin relative to the fascia and the connective tissue below it, but we can hardly affect any of the deeper structures. That too is why it's pretty safe to start doing this as early as you would like. As long as you're not pulling the incision apart, causing bleeding, causing seepage, you can start to mobilize as soon as you like. We learn in school that scar tissue is laid down kind of in a haphazard pattern when there's tissue damage. And so as you start to pull and move and stretch, those fibers that are laid down kind of like a crazy cobweb start to align, and now the fibers start to run parallel. And that's the way the fibers were originally, and we want to get those fibers organized and as parallel as we can and allow them to slide and glide over each other, whether we're talking the fibers of the musculature, the fibers of the fascia, the fibers of the skin. It's really all the same stuff. It's the same building material, just in different ratios. So let's get back to it. I know I keep interrupting here. I want you guys to see my knee. So I would find a place where you can sit. So I'm on the stairs, obviously, but you can be on a couch, leg totally straight. If you don't have full extension, that's okay. If it's a little bit bent, you do what you can. But in this position, you want to come right on that incision. I'll usually just use a thumb, one finger. I'll stick to the skin, and I'll mobilize and glide the skin back and forth. This is called a cross fiber massage, cross friction, sometimes people will call it. And what you'll find naturally is the skin on top is a lot more mobile than the skin at the bottom. That's very common. If you're able to move through the entire incision and you don't feel a tight or restricted area, let's say, for example, right here, I'm like, ooh, that's really limited. I can't move it, but it's mobile below and mobile above. I'm just going to spend a little extra time working on that area. No pain, maybe a little discomfort is okay. Then what I can do is I can do a different version where I kind of zigzag the skin again, just to feel and make sure that everything is moving and mobile the way it should. If I close my eyes while I'm doing this, other than feeling the actual lumpiness of the incision, I shouldn't know that I'm on an incision. And eventually, when I do this, I won't even know where the incision is because everything will be so smooth. In terms of the internal incision, so if you have some sensitivity on this and you're trying to figure out what to do, again, I can work my thumb over the general area. You're not going to know where that internal incision is. So I just kind of work my thumb over the area. I keep it dry. I don't use lotion. I let the skin move and glide as I'm applying that pressure. If I find a spot that's noticeably tender, perfect. I'll work on that a little bit longer. I usually say if you give me about 2 minutes working the superficial incision, maybe another minute and a half working that internal incision, that's plenty. It's not something you have to put 30, 40, 50 minutes of time into. You're just trying to kind of apply a little bit of pressure, then let the body and the tissue reorganize. It will take care of the rest. Our bodies are phenomenal at healing. You just got to get out of the way and let it do its thing. Really, I mean, that's it. You know, it's one of those things. You know what I want to do? I wanted to mention patellar mobs, because that's the other part that typically comes in when you're doing scar tissue mobs. Oops, sorry for shaking the camera. So patellar mobs. Let's go back. Knee as straight as it will go based on your level of recovery. If the knee is flexed, if you're at like 10 degrees of extension or less or more, however you want to look at it, you're not going to be able to move that patella. That doesn't mean it's stuck. That doesn't mean there's something wrong. It just can't happen. As you get down into closer to zero extension, the leg totally straight, Now that patella is gonna be able to shift, and you can see it in the video. So the center of my patella is literally under that line. As I shift it over, in and out, it just feels nice and mobile. And if you're not sure what that should feel like, use your other leg. Get to the other leg, shift the patella side to side. Typically what we're looking for is we just wanna do about 30 to 60 seconds of lateral patellar mobs. Sometimes I'll go below and above, and I just use my thumb and index finger. I'll move it up and down. The reason why that's so important is in a normal knee, normal movement without surgery for a second, when my knee is straight, that patella is kind of floating right over the top of the joint. As I start to flex and bend my knee, what happens is that patella will glide a little bit to the inside and then down, and it kind of sits in a groove. The tendon that's above the patella, because really your patella is just a bone floating in a tendon. The tendon above will sit inside the groove, when come down here, sit inside the groove of the femur. You still have that groove even after the knee replacement. So we wanna make sure that patella has the lateral and the up and down mobility to glide and move where it needs to. So again, if I do 3 minutes cross friction, cross fiber massage, I do another minute on that internal incision just to make sure there's no sensitive areas. I do a minute to a minute and a half of patellar glide, side to side and up and down. Your job is done. You are finished. Go relax, give yourself a little treat, do something that you enjoy, because this is the process of healing, and you cannot, you gotta be careful not to overwork the knee, the tissue. Just give it time. Rest, sleep, food, reduce stress. Those are the factors that are gonna lead to a positive outcome when we're talking about a knee replacement. Guys, I said I was gonna keep it short. I tend to be long-winded. I'll catch you guys in the next video. Post your questions if you have specific questions about what I said. As always, I appreciate your time. Hope we can help you get to where you wanna go. I'll talk to you soon.